Good morning, everyone, and greetings from Islamabad. Let me begin by congratulating the Nossal Institute for organizing this very important event. It is not just important, it is also very timely, both in the global context as well as domestically. It is timely in the global context because, as you're all aware, the Millennium Development Goals will come to term in 2015, and already discussions are quite further along in what the post-2015 goals will look like. And therefore, it's important that countries who provide development assistance and foreign assistance to the developing world convene and discuss on what the new imperatives are going to be. Secondly, from a domestic vantage point, it is also an important convening because I understand that the Australian Bilateral Development Agency, AUSAID, has recently been integrated with your Ministry of Foreign Affairs, and therefore it's important to look at what the new framework ought to look like. So for both these reasons, I think it's timely and it is very important. My congratulations once again. If you look at foreign assistance, there are many actors involved in it. They are the multilateral and bilateral agencies, the public-private partnerships, private foundations, the UN system. There are many instruments of aid. So we're talking about grants and concessional loans and debt swaps and aid in kind and so on and so forth. And aid is given to countries under different policy and contractual norms. My understanding today, however, is that we're talking about bilateral assistance and we're talking about grants. And if that is a correct understanding, I'd like to quickly outline 4 points. The first point is the fundamental difference between 3 forms of bilateral assistance. Humanitarian assistance, development assistance, and aid as a tool of foreign policy are 3 different things, and it doesn't help to mix objectives. In this part of the world, I have seen many bilateral agencies inadvertently make mistakes by trying to merge objectives, and there should be an attempt to keep them separate for very important reasons. Secondly, I was very pleased to see that on your conference banner, health security and macroeconomic growth were put together in the same title. There's a deep interrelationship between the two. And here, just for clarification, the frame of reference for health security is not epidemiological security, which is very much on the global agenda in the context of Ebola, as it should be. Here we're talking about financial health security in the context of universal health coverage and overall development outcomes. And within that space, I'm sure you all appreciate that there's a deep interlinkage of development outcomes with overall macroeconomic growth and the ability of governments to accrue the benefit of that growth equitably to populations. There's also a very deep interrelationship of development outcomes with job creation and with rise in per capita income. And the reason why I am consciously trying to make this reiterate the importance of this interrelationship between these 2 aspects is because sometimes this linkage tends to get lost when these 2 agendas are separately placed in different desks in the premises of development agencies in countries like ours. And I just want to reiterate the importance of the interrelationship and the fact that they should not be seen as 2 separate agendas. The third point I'd like to make is to emphasize that more resources do not automatically translate into better outcomes, because the effectiveness of aid is fundamentally linked to some deep-seated country characteristics. So laws, norms, practices, policies, mindsets, the overall effectiveness of governance, policy consistency, and the ability of the system to ensure policy consistency when governments change, accountability within the government system, and overall transparency matter deeply for aid effectiveness. And in fact, some of the surveys which have been conducted by OECD to assess the impact of the Paris Declaration on aid effectiveness about a decade ago were very illustrative in terms of the interlinkages between the country characteristics and aid effectiveness, and they are certainly worth a read. Now here, I tend to observe that aid agencies have a bit of a dilemma, because on the one hand, they're focused on sectoral objectives, on time-bound outcome-based targets. There are issues of attribution of success that they're concerned with, and I understand that they have to report back to their own governments, and for that reason, the attribution matters. But on the other hand, there's another basket of interventions that they could potentially contribute to, and those basket of interventions have to do with country strengthening and with institutional strengthening and ingraining better systems and processes. And here, inherently, bilateral agencies have to work collaboratively with other agencies, draw on comparative advantage, exploit synergy, and therefore attribution of success becomes a problem. And sometimes, sitting in this part of the world, I see that in the offices, there's a dilemma between, in terms of where the development dollars ought to go. And my sense is that in the context of the prevailing situation, and it may well be that development dollars are better off put in the latter category in strengthening systems and processes. And this brings me to the fourth point, which is about the context of aid. Many of you know that after the Second World War, foreign assistance has undergone different policy incarnations. So from the Marshall Plan-like packages to project assistance to programmatic assistance, we came to an era where aid started coming to countries on budgets. And it was the same time that the norms of aid effectiveness were articulated, the Paris Declaration, the Accra norms. And subsequently, around the same time, the MDGs came into effect. So the Millennium Development Goals were a very important tool of policy. They brought civil society, government, and donor agencies on a single platform. They mobilized development resources as well as country resources for common objectives. They fostered policy consistency. They became instruments of debt relief for countries. Their leverage was unprecedented. But the MDGs were focused on time-bound, outcome-based targets. They were very vertically orientated. And now that we're moving towards the post-2015 scenario, not only does the world look very different, from a fiscal standpoint, the focus is on very different things. So the focus is on sustainability, it is on country ownership, it is on institutional strengthening, it is on the future of the planet and the people, it is on the whole of government approach. So in a nutshell, the MDGs were developed for the aid system in an environment where there was a lot of fiscal space. But on the other hand, the post-2015 goals are being framed in a context of resource scarcity and fiscal crunch. The ownership and the onus of responsibility is very much on governments to mobilize domestic resources and to take ownership of those goals. Now this brings us a little to what health looks like in post-2015. Now in the MDGs, there was a focus on a few maternal and child health indicators and on a few infectious diseases. But in the post-2015 framework, the indications already are that there will be an emphasis, and we hope that that will be the case, a focus on universal health coverage and non-communicable diseases. Both of them are very complex policy agendas to deliver. Unless there are strong country systems, unless there are country systems to make evidence available on an ongoing basis and to shape policy according to evidence and to forge intersectoral action, we will not make success. So countries have to clearly understand and appreciate that they will need to invest in these areas. And the onus of responsibility also has to be on the development partners to step up their capacity, which is really a very tall ask, both of governments as well as of development agencies. And I hope that they will step up to this task. But this also requires a fundamental rethink and a reshift in donor priorities, donor allocations, and the way they engage with governments. I know that in the end, Peter Anier asked me to talk a little about the role of Heartfile, and I just want to say in passing that we are a civil society agency based in Pakistan, and we play all the traditional roles which civil society agencies play, acting as a watchdog, playing the role of a policy analyst, advocating for change, extending a helping hand to governments, and being there when you're needed. So it's a bit of a schizophrenic role, but we try to balance it, and we try to do whatever we can within our modest means. So let me end by saying how sorry I am not to, because of my inability to not being here with you today. I'd like to wish you very well with your deliberations, and I'd like to congratulate the Nossal Institute once again for this convening on a very important subject. Thank you very much for having me amongst you, and goodbye from Islamabad.